Hello, welcome to my practice. My name is Dr. Freeman. My website is www.onlyfaces.com, and I'm here today just to give you an overview of the practice and basically the things that I do routinely here in wonderful Charlotte, North Carolina. My practice has been up and running since 1988 in Charlotte. My present location, however, I moved to in 2000 and have been here since the year 2000. My office is located in beautiful southeast Charlotte, off of 485. I purposely picked that location because I have a lot of patients who come from outside of Charlotte, either in the southeast or occasionally even from around the United States and internationally. So having easy access to 485 allows them to come to and from the airport or from other interstates without too much difficulty. My practice has been focused solely on facial aesthetics and reconstructive work since I finished my residency in otolaryngology and my plastics training in facial plastic surgery back in 1988. I was lucky enough to pass both my boards without too much to do soon thereafter. Over the time of my practice, I've developed several techniques which have given me the opportunity to speak nationally and internationally, teaching other surgeons how to approach the face using my ideas. The ideas that I've propagated and come up with have to do with aesthetic surgery mainly. One of them is how I manage the aging of the lower eyelid, and that approach is known as a soufflift blepharoplasty, a concept I came up with in the mid-1990s and have written extensively about and traveled quite a bit around the world teaching other doctors how to do this procedure. Advantage of doing that sort of work, I mean lecturing and traveling and interacting with other peers, is that I've learned at an early age, relatively speaking, how to incorporate my mid-face surgery with deep plane surgery, and have been using this tri-layer approach to rejuvenate the face for over 10 years with what I consider to be very natural, long-lasting, good-looking results. I'll let you be the judge of that after you have perused my website and seen all my photos. I think you'll agree there is an advantage to using the approach that I've come up with and help to teach around the country. I do a lot of rhinoplasty. Actually, it's my most favorite, or the one I enjoy the most, I should say. That and revision rhinoplasty has become more common in my practice over the years. I find myself fixing rhinoplasties that have been done by other doctors who have tried hard but just didn't work out well. Why do I like this procedure so much is because every rhinoplasty and revision rhinoplasty I do is different. I try to make each nose that I operate on fit the patient's unique facial features, and it requires years of training and experience and learning from past experience in order to get good at doing that particular procedure. So I pride myself on being very, very good at that procedure and individualizing each case. The other things that we do here include using endoscopes to do mid-face work and brow surgery. The brow surgery technique that I have developed over the years has evolved, I should say, to the point now where I'm doing different lifts in different people, again based on their anatomy and skin thickness, and that's another approach that I've started to teach around the country to better adapt the lift to the individual patient. Again, trying to get as natural a result as possible. All of my staff has typically been with me for years. They're all dedicated to giving each and individual patient the utmost courtesy and information, answering all your questions, and they have lots of good stuff that they can discuss with you over the phone or when you come into the office. I look forward to seeing each and every one of you. I do my own consultations. I spend a good 30 minutes with each individual patient, not to try to talk them into surgery. I'm 60 years old. I don't need that. My goal is to try to discern if what I can provide for the patient will be what they're wishing for, what they're desiring, and trying to make sure that they only undergo surgery if they are being realistic about what to expect. So that's my goal when I see each and every patient. I also do my own injections of Botox and filler, which is somewhat old-fashioned, but I think also important. So without further ado, I thank you for visiting my website, and hopefully I'll see you soon in Charlotte. If you require further information, there's loads of it on my website and on YouTube and other such internet entities that fortunately my webmaster understands. Thank you for your attention.